Hello and welcome to this webinar on COVID-19 advice for workers and employers from Industrial Global Union. My name is Walton Pantland and I will be moderating today's discussion. This session will be in English. In 2 hours' time, we will hold a webinar in French and in Spanish later this afternoon. The coronavirus crisis means we are unable to meet each other in person, but we need to share information and solidarity now more than ever. This is the first in a series of webinars that we are planning to hold to keep communication flowing between unions as we face this unprecedented situation together. Today is the 28th of April, International Commemoration Day for Dead and Injured Workers, and Industrial's health and safety expert, Brian Kohler, will be speaking on new coronavirus advice for workers and employers. Brian will present the guidance he has prepared and then take questions. If you have any questions or need some advice about a workplace situation, please leave a comment below the video. I will put your questions to Brian, who will then answer them. But first, let's hear from Industrial General Secretary, Valter Sanches.
Hello, sisters and brothers. I'm Valter Sanches, the General Secretary of Industrial Global Union. Welcome to our webinar on the World Day for Safety and Health at Work, as the ILO used to call it, or International Workers' Memorial Day. So this is the day where we mourn and honor the dead, but fight for the living. And this is the moment when we honor the hundreds of, for example, Pakistani mine workers that lost their lives in the last period. We keep on fighting for the ratification of Convention 176. We mourn and honor the dead in Izmir, in Soma mine in 2014, the 300 killed in this industrial homicide. Just last Friday was the day that we commemorated the 7th anniversary of Rana Plaza in Bangladesh that collapsed and killed 1,100 sisters and brothers. So this is the day where we have to honor the dead that built the wealth of their companies and lost their lives in the place of work. So in the times of this pandemic, this is also a moment for us to honor over the 200,000 people that lost their lives to the virus. Those were workers that built the wealth of the world, and they were the system failed on them because of after years of neoliberal policies that destroyed and weakened the health system, the public health system. A lot of lives could be saved in this pandemic, but this is another fight that we have to carry on. And of course, we are very much concerned about the socioeconomic developments of this crisis. And of course, we are fighting along with our affiliates for the jobs and income of the workers. But of course, the health and safety of the workers is are having contagion at the workplace. So we are issuing a number of initiatives during this pandemic crisis. We're trying to keep the organization up and running. We're trying to work in a sectoral basis to get commitments from companies, try to get commitments for the companies we have global framework agreements with. We're trying to work with other multilateral organizations. And also we're providing you with some materials that Brian will later mention about. So this advice for workers and employers that we just issued, the publication on right to refuse unsafe work, and also the set on our website that we're putting together to update the achievements and fights from our affiliates so that we can learn from each other and fight this pandemic together. So let's use let's make the best use we can from this webinar so that we can strengthen our knowledge about the issue and also strengthen our links of solidarity. Welcome and enjoy it.
And we are going to go straight on to Brian Kohler, who's going to share his advice about COVID-19 for workers and employers. And if you have any questions, please type them in the video comment box. So over to you, Brian.
Thanks very much, Walton. And just a minute here and I will put up a little bit of a presentation. Okay, Welcome to this webinar on the new coronavirus, also known as COVID-19, caused by the virus known as SARS-CoV-2. Today, as you know, is April 28th, a day of mourning, a day of commemoration for workers killed or injured on the job. And it's very appropriate that we choose today as a day to do this webinar on this new occupational crisis. First, a word or two about IndustriALL, for those of you who may not know. We are the largest and most important global organization of trade unions in industrial sectors. We represent some 50 million workers globally throughout the entire alphabet of industrial production, from aerospace to zinc coating. And our labor creates the energy, the materials, and the products that modern society rely on. We organize our work around 5 strategic goals: defending workers' rights, building union power, confronting global capital, fighting precarious work, and promoting sustainable industrial policy. Occupational health and safety cuts across several of these, particularly workers' rights and sustainability. Well, in a few weeks, everything seems to have changed, and yet in some ways, nothing has changed. IndustriALL Global Union views occupational health and safety as a matter of workers' rights and employers' responsibilities. The extraordinary situation created by the outbreak of COVID-19, the disease caused by the new coronavirus, does not change these fundamentals. In fact, they are now more important than ever. So what is this new emerging hazard? Well, what we're facing is a new coronavirus disease, technically known as COVID-19, and the virus itself is technically known as SARS-CoV-2. The frightening thing about it is it's a new development. It's a virus to which no one has existing immunity, and it's sweeping the world, closing businesses, forcing people to shelter at home in order to slow the infection rate so that the healthcare systems are not overwhelmed. Yet, at the same time, it's an infectious disease like many others. And the prevention of infection by following principles that have been known for a long time is not something that we need to reinvent. The World Health Organization, which is also known by its initials WHO, says that when somebody has COVID-19 and they cough or exhale, they will release droplets of infected fluid. Most of these droplets will fall on nearby surfaces and objects, such as desks, tables, or telephones. People could catch COVID-19 by touching contaminated surfaces or objects and then touching their eyes, nose, or mouth. If they are standing within 1 meter of a person, they can catch it by directly breathing in the droplets that are coughed out or exhaled by them. In other words, it spreads in a similar manner to flu. Alarmingly, though, it seems that infected people who do not yet have symptoms can nevertheless spread the virus. What happens then? Well, most people infected with COVID-19 experience mild symptoms and recover. However, some people will experience more serious symptoms and may require hospital care. The risk of serious illness rises with age. People over 40 seem to be more vulnerable than those under 40. And this increases with age. If you're over 65 or 70 or 75, your risk increases accordingly. Pre-existing conditions such as diabetes, heart and lung disease are also going to make you more vulnerable to this serious disease. What are the symptoms? Well, knowing the symptoms are important in order to identify whether you or a coworker may be at risk or causing a risk to others. The most indicative symptoms are fever and a dry, continuous cough. Also, fatigue, sputum production, shortness of breath, muscle or joint pain, and in some cases, sore throats, headaches, chills, nausea, or vomiting, or others. These symptoms can be found on the website of the WHO as well. If you experience symptoms while at home, stay home. If you first experience symptoms while at work, inform your employer and then go home. And while you're awaiting transportation to go home, keep distant from other people at least 2 meters, and probably you should wear a mask. Call a doctor. You and the people living with you will have to self-isolate, And if your symptoms worsen, you'll have to seek medical advice at once. And if possible, get tested for the presence of the virus. Now, these tests are in short supply at the moment, but we expect that as this progresses, the tests will become more readily available. Now, joint health and safety committees and safety representatives should ensure appropriate jointly agreed upon workplace policies, programs, and procedures. Good policies, programs, and procedures only work when they're followed. That means that there should also be a protocol to effectively monitor their implementation. And that also should be a jointly agreed upon protocol. The trade union movement insists that workers have 3 fundamental occupational health and safety rights, and they are to know fully and completely and wall-to-wall everything there is to know about the hazards of their work and to receive the necessary information, education, and training to do the work safely, to refuse or shut down unsafe work without fear of discipline, discharge, or other negative repercussions if exercised in good faith. That means even if it's later proven that your belief that a job was unsafe was perhaps unfounded, you would still be protected. And finally, to participate fully in the development and implementation of all health and safety policies, programs, procedures, hazard and risk identification and assessments, accident investigations, and so on. We want to be full partners. We want health and safety done with us, not to us. The current crisis with COVID-19 has highlighted some of the deficiencies in the understanding and recognition of these workers' rights, particularly the right to refuse. So let's explore that just a little bit. First of all, we say that there should be an internal responsibility system, and internal means within the workplace. We say that we want systems in place that will assure that most of the time occupational health and hazards are identified and rectified in the workplace by the workplace parties without recourse to external inspection by, for example, the government inspectors. That's not to say that they are not important as well. It's simply to say that we believe that an internal responsibility system is one of the first starting points. What do we mean when we say somebody has a right? Well, a right is something that you are morally or legally entitled to do or to have. Workers do not automatically enjoy the legal right to refuse or shut down unsafe work in every jurisdiction or in every circumstance. However, we always have the moral right to refuse or shut down unsafe work. In serious circumstances, we believe that not only do we have the right to refuse, we also have the duty to do so. Our problems arise when the exercise of that right is not respected or protected from reprisals by the employer. And I want you to notice that whenever workers do enjoy the legal right to refuse unsafe work, whether it's in law or in collective bargaining agreements, it has always followed worker activism, and demands never preceded it. Our rights are rarely given to us freely. We must always demand and fight for them. In international law, the United Nations Universal Declaration of Human Rights says that everyone has the right to life, liberty, and security of person. It does not state that these rights disappear when you go to work. But in international labor standards, the most important references are those from the International Labor Organization, or ILO, which is a specialized UN agency dealing with labor standards. The ILO has several conventions and recommendations that mention the right to refuse unsafe work, but the most significant of these is probably Convention 155, the Occupational Safety and Health Convention. And it has a number of detailed references to it in somewhat legalese language, but in plain language, what it says is that within the context of national law, workers can, with reasonable justification, remove themselves from unsafe work and not return until the employer has remedied the situation. And if they have exercised this right in good faith, they cannot suffer undue consequences. Other ILO conventions do also make recommendations to this, and recommendations. Conventions have legal standing when ratified. Now, your national government may not have ratified them. Recommendations, as the word suggests, are not necessarily legally enforceable. However, both recommendations and conventions can be referred to as being part of international best practice, and sometimes even in countries that have not ratified the relevant convention. As for your national law, well, it still applies. The coronavirus crisis has not abrogated the rule of law. The wording varies in different parts of the world, therefore you will have to refer to an expert in the jurisdiction that you live in. However, in most cases, they provide that employers are required to protect the health and safety of their employees, provide information, education, training, and the correct equipment to do the job safely, and that has not changed. Also, specific laws or regulations may have been enacted to deal with the coronavirus crisis, and you should make sure that your workplace is in compliance with all of these. Now, where the right is protected in law, there will normally be a strict procedure that you have to follow in order to exercise that right in the legal sense. It will outline what kinds of hazards or risky work are legally refusable and the steps that you must take to refuse, which normally include reporting the danger to your supervisor, removing yourself from immediate harm, and then a process for the investigation of the hazard that you have complained about. Follow this procedure closely or you will be exposing yourself to repercussions. Also in your collective bargaining agreement, you should check many collective bargaining agreements make reference to the right to refuse or shut down unsafe work. Often a strict procedure must also be followed to exercise this right, and you should familiarize with this procedure in order to protect yourself from discipline or discharge. Now here's where occupational health and safety situations differ from other labor disputes. Where there's a disagreement in the interpretation of labor law or collective agreements between an employer and a worker, usually we advise comply now and grieve later. This advice protects the worker from immediate discipline or discharge, and if a labor arbitrator or judge later rules in favor of the worker, an appropriate remedy can be applied. Lost wages can be repaid, workers can be restored to their rightful positions, and other indignities can be compensated. But in the case of occupational health and safety, you cannot say that this general rule would apply. There is no remedy that an arbitrator can impose that will restore life or health if it is lost. Therefore, the right to refuse or shut down unsafe work is something that you have to consider exercising even when you will face possible repercussions, because you have to weigh the fact that your life is something that cannot be bargained with. The right to refuse or to shut down unsafe work is not automatically guaranteed by your CBA, and therefore you have to assert it in order to use it. And we say, not only do you have the right to refuse unsafe work, we also say, please don't take your right to the grave. Now let's talk about specific workplace measures to deal with the coronavirus crisis. The normal industrial hygiene process is to start with identifying the hazards. So hazard identification and risk assessment, which should be done jointly, because we as workers demand the right to participate, and the only people with the moral authority to assess a risk are those who face the risk. Be aware when you're assessing the risk that the virus can be transmitted before symptoms appear, and be aware of the symptoms for your own sake as well as others. The next step, once you've identified risk, is to control it. The principles of personal and industrial hygiene remain the same for COVID-19 as for other biohazards. Eliminate or completely isolate the hazard is the first choice. Minimize the risk by eliminating as much as possible the opportunities for transmission of the virus is the next possibility. And finally, to provide effective personal protective equipment. Now, we recognize that it's impossible to entirely eliminate or isolate this hazard in this case, since any person in the workplace may be carrying the infection and not even know it. Therefore, we have to minimize the risk using the following strategies. First of all, personal hygiene. Frequent and thorough hand washing with plenty of soap and water is something that every authority recommends. It should be lots of easily available hand sanitizing stations at strategic locations throughout the workplace. There can be posters explaining what a thorough hand washing means, and there should be some education so that people understand that they should avoid touching their face, eyes, nose, or mouth with unwashed hands. Drying with paper towels is preferable to the hot air dryers, which unfortunately can disperse any remaining viruses widely in the airspace. and promoting good respiratory hygiene in the workplace by encouraging everyone to use tissues when they cough or sneeze, or if none are available, to cough or sneeze into the crook of their arm. Other communications and education and training can also be helpful. Next, industrial hygiene. Housekeeping measures. A regime of frequent cleaning and disinfection of surfaces, all surfaces, machinery, tools, controls, handles, keyboards, touch screens, telephones, office devices, doors, banisters, and furniture. Cleaning of the surfaces should be done with an appropriate disinfecting material like alcohol, hydrogen peroxide, or chlorine bleach at sufficient concentrations for a minimum time of 1 minute to make sure that everything is disinfected. Any obvious contamination with blood or bodily fluids should be treated with extra care, both to disinfect the site and to protect the cleaning staff. Cleaning staff should be educated and trained on how to do proper disinfection, and frequent cleaning of workplace surfaces, particularly at shift change, can be quite important. Employers should ensure that there are adequate supplies of stocked things such as cleaning supplies, tissues, first aid supplies, and personal protective equipment. There should be good ventilation. Social distancing should be observed in the workplace where it's possible to do so, and that can be done in various ways. Where working from home is possible, it should be allowed. Flexible schedules or staggered shifts can be considered to reduce the number of workers who come in close contact with each other. All non-essential travel and meetings should be canceled and substituted with virtual meetings, and workers in high-risk categories because of age or pre-existing medical conditions should be accommodated. And finally, pay particular attention to how you dispose of waste, because contaminated tissues and so on need to be disposed of safely, or they create a new reinfection possibility. Handling cases. If a suspected case is identified in the workplace, medical advice should be sought, and the person should be sent home or to medical care immediately. While awaiting transportation, the individual should isolate from others and wear a mask. The suspected infection can reduce, by wearing a mask, the suspected infected person can reduce the risk of passing the virus on to others by means of droplets. All items and surfaces that the individual has been in contact with need to be disinfected, and all people that he or she may have been in contact with should be identified and monitored for future follow-up. Finally, personal protective equipment. There's been a lot of debate about the wearing of masks. Masks are not perfect protection. You have to understand that even an N95 mask, the number comes from the fact that it will stop 95% of respirable particles, not 100%. That's if it's properly worn and properly fitted. What the world is leaning towards now is to wear masks more than not. So initially there was a recommendation that masks were not generally recommended outside of a healthcare situation or with frequent contact with the public. Now there has been a shift towards recommending the wearing of masks in more circumstances than that. And it's partly to protect yourself, but more importantly, it's to protect others. Since we know now that the virus can be transmitted before you have symptoms, anything that will reduce the transmission of droplets when you cough or sneeze can reduce the chance of transmission. And even a poorly fitting mask or a homemade mask is better than no mask. Not all masks are the same. As you know, I've referred to the N95, which is a US designation. It's also known as FFP2, which is an EU designation. They're more or less the same thing. At the moment, these particular types of high efficiency masks are in short supply, and they're being prioritized to healthcare workers and people who are already sick. But any mask, regular paper, medical or surgical masks, the ones that don't form a close seal, still will reduce the transmission of droplets when coughing, sneezing, or talking. So consider them where social distancing cannot be maintained. We recommend, however, that a mask program be initiated only if information, education, and training in their proper use and disposal are provided. And if you need further guidance on how to put on, take off, or dispose of masks, the World Health Organization has such advice on its website. Finally, social protection. Workers need to understand that even mild symptoms mean stay at home. This message should be as clear as possible. To make it clear, workers must be guaranteed that their pay will be kept whole in case of absence for illness. Otherwise, the risk is that people will report to work even if feeling ill and spread the virus. Also, we need to consider in this time of isolation, mental and emotional health. People will be fearful in these circumstances, and working from home may experience stress from the social isolation. Finally, there needs to be a plan to handle what happens if somebody develops symptoms at work. They need to be safely transported to medical care without contaminating other people. Visitors to the workplace should be screened and identified, and records kept of who has been in the workplace, who they've been in contact with, where they have visited, in case follow-up is needed. We ask you to visit IndustriALL's special website on COVID-19, which the web address is at the bottom of this screen here, www.industrial-union.org/COVID-19. So in conclusion, let me just say that although this is a new set of challenges for health and safety in the workplace, in many ways, things have not changed. We still demand our rights. We still expect our workers' rights to be respected by employers. We still expect employers to make the workplace safe as possible. And of course, unions make work safer. Thanks very much. And I'll pass it back to our moderator.
Brian, thank you very much for sharing that really useful advice with our listeners. And we've started to have a number of questions come in. The first question, I think, may actually be for either Valter or Kemal, someone in our leadership team, because it's more of a union political question. And it's from Khawaja Mubashir Zubair in Pakistan, who says, employers in Pakistan are not paying salaries despite the government policy that they should. What can be done for the workers? What can unions do in this situation?
Of course, it's unfortunately it's not only the case of Pakistan. We have some other governments that are not fulfilling their obligations for social protection. I mean, the response for workers is always to fight, and of course we're ready to provide all solidarity. I just got a message from one of our affiliates in Pakistan this morning, requesting that we try to intercede along with the government in Pakistan to make them fulfill their obligations to provide social protection for workers.
Thank you, Valter. And I think that the next question is probably for you, Brian. And this question is, if I don't have adequate PPE, can I go on strike?
Strike is a collective right, and I was talking about the right to refuse. If you don't have proper PPE, it seems to me more likely that you should try to invoke your right to refuse unsafe work. If you feel that you are at risk of contamination with the virus, that's a situation where I would say it's your right to refuse unsafe work. Exercising a collective right like a strike in the face of health and safety is usually, well, it certainly happens. I've been part of them in the past, but it's fraught with a different set of labor relations risks. So first step, I would say, is if you're in an unhealthy situation due to a lack of PPE, you have the right to refuse work based on that risk.
Thank you very much, Brian. We have another question, which I don't know who wants to answer this one, but it's from Portugal. And the question is, can you comment on the fact that some governments are using the pandemic as an excuse to limit fundamental rights, including the right to strike? How do we fight back against it? Who wants to take that question?
Yeah, I mean, thank you for the question. Of course, it's a risk. I mean, democracy is. I mean, we see a number of governments, like in Hungary, in Poland, and in Brazil, that are taking a bad approach in this pandemic times, and trying to use the situation that workers cannot doesn't have the chance to really demonstrate and try to pass over and attack democracy, concentrate more power, and this we have to be very attentive to this and working together in solidarity. And I think we have to find new ways of fighting back. For example, we're about to have our May Day next Friday, and we're gonna do it in a virtual way. But we have to increase the pressure, put pressure on international multilateral organizations, and try to strengthen our solidarity so that we can fight back.
Okay, thank you very much, Valter. And so we have another question here, and this one I think probably depends a lot on which country you're based in, but it's what protection, if any, do informal workers have during the pandemic? And I think we've all seen the situation where informal and precarious workers are the ones who are facing absolutely the worst of it, because many of them are forced to work because they're getting no pay, they're getting no income, and they're having to do things like delivery jobs and so on. What do we do for workers in this situation?
Well, I can try to answer part of it, and maybe my colleagues will jump in and add to it. But if you are a precarious worker, clearly you don't have the right to refuse unsafe work protected in your collective bargaining agreement because you won't have one. There may still be a right to refuse unsafe work in national health and safety laws, depending on where you live, which you can attempt to exercise. But of course, without the protection of a union, the reality is exercising your right to refuse is more risky in terms of losing your job than if you have a union, even if it's protected by law. This is the unfortunate reality. However, I would go back to the earlier statement I said, which is if your health and your life are at risk, you really have no choice. I mean, limited rights as they may be, you're probably better off to exercise them and see what the consequences are than to lose your life. Now, as far as other protections for precarious workers, it's an illustration of where we are in a society, and our answer to that is always to unionize, if possible. I mean, use this crisis as a triggering point, perhaps, for an organizing campaign, because it illustrates clearly the situation that workers are really in. Maybe anybody wants to add to this.
Yeah, maybe I could just join that. We are, along with the global unions, what we are always standing for is for a universal protection for workers, because we have the reality today is like in countries like India, like Kenya, like Brazil, the number of informality is very high. We have in countries like India is the majority, absolute majority, and over 90% of the workers are not in the formal sector. So, which means that if we think of only about collective bargaining protection, we're not achieving most of the workers. So that's what we're demanding: universal social protection for all workers, despite of being precarious or not.
Thank you, Valter. So we have a comment from Lala Sultan Khan in Pakistan again. And this one is actually, it's more of a reminder that because it's International Day to commemorate dead and injured workers, of the crisis in Pakistan's mines and the high death rate there, and the fact that there's a campaign for ILO Convention C-176 on safety and health in mines. And he is saying that, can we please remember all the workers who are dying in those industrial homicides, and also wondering, is there anything in that convention that overlaps with the coronavirus advice? Is there a requirement in that convention to provide a safe working environment?
Yes, very much so. Also, Convention 176 is one of the ILO conventions that does talk of the right to refuse unsafe work, the right to participate, and the right to know about the hazards of work. So all of the things that I've been discussing actually in this presentation would be improved greatly if Pakistan ratifies Convention 176, which is what we're campaigning for.
Thanks, Brian. And now we have another question, which is, what do I do as a worker if I feel that rules and safety measures are not being respected by my co-workers and I don't feel safe at work?
This is always a problem. one thing you have to realize is that the authority to impose rules and to enforce them is the employer's. As the co-worker, you don't have the right to order your co-worker to behave in a certain way. If they're behaving unsafely and putting your life at risk, you have the right to refuse unsafe work. And if you wish to report to the employer, what I would do in a circumstance like that would be to say to the employer, this rule that's been set up for the protection of workers is not being followed, and you need to implement some sort of enforcement or further education. But I would not name names. I would simply say the rule is not being followed, and leave it at that.
Thank you, Brian. And we have a comment here from Lina Juliana, I think in Indonesia, who says, many white-collar workers are working from home. Meanwhile, blue-collar workers are still at factories, and shutdown only happens until there's actually a case of coronavirus at the factory. Yeah, the employer says they need to run factories to pay workers. Yeah, she's making a comment about informal workers and essential workers, and the fact that there's a definite divide in the kind of work, who's suffering most from the coronavirus system, and how it's highlighting the inequalities and injustices in the workplace. I don't know if you want to add any comment to that, or whether you just want to wrap up at this point.
Well, white-collar workers generally, not always, generally have greater opportunities to work from home and do it by telework, as we've seen a lot of workplaces move to that in this crisis. Blue-collar workers, because of the nature of industrial production, are often required in the factory. And a surprising number of factories have been declared essential in many countries. Factories that produce things that you perhaps wouldn't have thought of. I know of workers that work in a plant that makes acrylic plastics that were designated as essential workers because acrylics are used in some of the masks and devices that are needed at this time. So they are still going to work in a chemical polymers factory. That's just one example. Yeah, I mean, in this situation, if they can't maintain social distancing in the industrial facility, they should be aware of their rights to, if necessary, refuse unsafe work. And yes, it's one of the distinctions between blue and white collar workers that we've been discussing at IndustriALL.
Thank you, Brian. And there's a question here. What is reasonable to demand from your employer in terms of financial support? Can you ask them to pay for hospital-related costs during COVID-19? And I'm imagining here it's a circumstance where you've contracted it due to being at work.
Of course, this is one of the demands that is basically, I mean, general access to health and coverage of health insurances for all the workers is one basic thing that we are demanding along with most of our affiliates. Of course, it makes a lot of difference when you have collective bargaining provisions on that. But in principle, we should demand that, you know, that every country should have a comprehensive universal health system for everyone, that everybody is a human right to have access to health protection. So this is I would say that, you know, it's one of the priorities of fights for all the workers. And I have some very good examples that I invite again everybody to check on our website in a specific piece on this subject that we have on the coronavirus, because we have a number of our unions that have some achievements on this.
Yeah, if I could add to that, I think that part of the question may have touched on the recognition of COVID-19 as an occupational disease if it's contracted at the workplace due to the negligence of the employer. And the Council of Global Unions, of which IndustriALL is a part, has just issued a statement demanding that COVID-19 be recognized as an occupational disease.
Thank you very much, Brian. And we have a follow-up comment to the C1761 that we had earlier, which is just saying that what's happened in coronavirus is that because of coronavirus and the minefields, the coal minefields in Pakistan, is a lot of workers are stuck at the workplace with no access to transport, food and medicine. And they're asking IndustriALL to please write a letter to the Prime Minister of Pakistan to address this urgent situation. I'm sure that's something that we'd be quite happy to do.
Yeah.
Indeed, this is one of the things that we will provide, and I mentioned in my early statement that we are very much concerned about the hundreds of loss of lives that we had in Pakistan, specifically on the mines in Pakistan in the late years, and we'll do everything to support our affiliates there.
Thank you very much, Valter. And then there is another question. What about parents who are obliged to work because they're essential workers, but suddenly they have additional childcare costs which they can't meet because, well, the schools are closed or whatever, so they have a childcare cost that they wouldn't have otherwise. Is it reasonable to ask the employer to make a contribution to that cost?
I think it's entirely reasonable to ask the employer to contribute. What kind of response you would get is a different question. But this is a situation that has been referred to our Director for Women, because in the midst of this crisis, I think it's also highlighted in many countries the particular situation of women workers who, in addition to being isolated at home, may have additional childcare responsibilities because of the closure of schools and creches and so on. Now, if you want those workers to return to work, we have to be aware that if the schools and the creches don't open at the same time, they will be extremely disadvantaged in terms of return to work. So this turns out to be, at least partly in this sense, a women's issue as well.
Thank you very much, Brian. I don't think that we currently have any more questions. So is there anything you'd like to say in conclusion, Brian?
I think there's been a lot of attention paid to the advice that IndustriALL has put on its website in this circumstance. And I think one of the reasons for that is that we have positioned it within the framework of occupational health and safety from a trade union point of view. So the emphasis on workers' rights to know, to refuse, and to participate is absolutely crucial. And the fact that we are in an unusual situation, a crisis that no one anticipated, doesn't change our demands for those three rights, and in fact reinforces the need for them. So I think that's the message I really want to deliver. You know, occupational health and safety, and in particular on April 28th, the Global Day of Commemoration for Dead and Injured Workers, is a day to remember that we are the ones that pay with our lives when things go wrong at the workplace. And it's our right to stand up for that. It's our right to defend our lives. It's our right to participate. We are the only ones that have the moral authority to make those choices in a workplace, no matter what the law says. So it's really a teachable moment, I think, for many people as to what a trade union means in terms of occupational health and safety in the workplace.
Brian, thank you very much for those words, and that brings us almost to the end of this webinar. Before we close, can we just have some words from Assistant General Secretary Kemal Ozkan? Kemal, over to you.
Oh, thank you, Walter. Let me thank Brian and Walter for their comments. And indeed, this was a very useful exercise to understand the health part, workplace part of the current crisis. Indeed, this is not the first crisis of neoliberalism, capitalism. The last one was in 2008. At that time, we lost our jobs, our incomes, but this time we are also losing our lives. And tens of thousands of people have lost their lives, and many more will continue to suffer lasting health effects. So this is why let's mourn all together all we have lost throughout the world, including the members of our affiliates in different countries. And we wish recovery to all those who are still at the hospitals, at home, waiting treatment. And please also allow me to salute the healthcare workers and other workers are in frontline sectors who try to give all the essential services for saving our lives at this critical time of COVID-19. Indeed, the current crisis once again shows us that the current model of globalization, neoliberalism, has failed. And this is imposed to working people, working men and women. And it also showed that this privatization, deliberalization of health systems, public services, has just brought us this unacceptable situation. At the same time, many governments are now enacting emergency measures to restrict our fundamental rights, right to speech, right to assembly, right to organize, right to strike. And this is not the way that we can really appreciate. So at this stage, I can tell you that May Day is approaching, and I believe world should again remember the value of solidarity. If this crisis is going to be overcome, it can only be done through solidarity, solidarity among nations, solidarity among workers, and then we will speak out for solidarity during this May Day. We need our jobs, and as most of them are destroyed, 200 million jobs are expected to be lost in the period to come, according to the estimations of the International Labour Organization. So this is why we need jobs, we need decent work, we need good health and safety conditions. And at this conjuncture, we demand from the governments, all international agencies, to recognize COVID-19 as an occupational disease, as Argentina has recently done with the Fernandez government. Of course, formalization of work and to eradicate precarious work. We also need to make sure that our incomes are in place, and we need to put sufficient income for everyone. This universal basic income needs to be an agenda item for each and every government, for the international, the global governance system, and of course, social protection. Now we once again realize that social protection is an essential part of our life, our professional life, personal life. This is why all the new system needs to be designed to make sure that everyone has a social protection. And today we have focused on the health and safety part of COVID-19. In the days to come, we will have a further discussion about economic, political dimension of this crisis, because we need to be able to regenerate our trade union movement in a way to be able to increase resilience of our workers, our members on the ground. Let's continue to work together. Let's keep struggling for our fundamental rights, for our life, for our jobs, for our incomes, and let's try to create a better, brighter future for the working class throughout the world.